नमस्ते मैम। नमस्ते मैम।
नमस्ते।
हाय संगीता।
हाय।
नमस्ते मैम।
Hello. Namaste. You're fine, both of you?
यस
Yes,
मैम।
ma'am. How are you, ma'am?
Good. Thank you.
Sir is not showing online.
Sir is trying to come. Join. He'll be joining first.
Yes, ma'am. Namaste, sir.
नमस्ते सर।
How are you, sir?
Fine, fine. How are you both?
We are good, sir. Yeah. So, welcome everyone in our episode 15. Myself, Sangeeta Singh from Bhopal and Deepika Singh from Delhi. We both welcome our guest speaker, Dr. Rajkumar sir and Dr. Ramya Krishnan ma'am, pioneers of SBBA. Dr. Rajkumar sir, HOD and Associate Professor of Yoga Nidana Department, Government of Puducherry, Mahi. Dr. Ramya Krishnan ma'am, HOD and Associate Professor in Devaguna Department, Government of Puducherry, Mahi. Uh, we both welcome you, ma'am and sir, in our episode 15, Shalya and Shalakya Tantra exclusive. So, before starting to, Shalya and Shalakya Tantra questionnaire, I would like to ask Deepika about her experience in Shalya and Shalakya classes in final year also, as well as in OPD in internship. How was her experience? Please share with us.
नमस्ते एवरीवन। मैं सर दीपिका सिंह। प्रेजेंट सिचुएशन जो हमारी शल्य शलाक्य की है एज वेल एज ऑफ बीएमएस वी कैन सी बाय दिस श्लोक यथा खर से चंदन भारवाही भारत से वेत्यु न तो चंदनस्य एवं ही शास्त्राणि बहुन्य आदित्य च अर्थेषु मूढ़ा खरवत वहन्ति। Am I audible, sir?
Yeah, voice is a little low,
Okay, okay, okay.
but okay. Yeah.
Okay, I'll repeat. Present situation of shell and shalake as well as whole BMS can be interpreted by this shlok. That is, यथा खरस्य रथा खरस्य चंदन भारवाही भारत से वेति न तो चंदनस्य एवं ही शास्त्राणि बहुन्य अधीत्य च अर्थेषु मूढ़ा खरवत वहन्ति. जैसे जो खर होता है, जो गधा होता है, उसे सिर्फ चंदन के भार का ही ज्ञान होता है, बट उसके चंदन के गुणों से उसे कोई कोरिलेशन नहीं होता. उसको उसके गुणों को नहीं जानना है. उसके लिए सिर्फ चंदन एक भार की तरह है. उसी प्रकार जो मूढ़ पुरुष होता है, वो शास्त्र का अध्ययन तो कर लेता है, लेकिन तात्विक अर्थ का अध्ययन नहीं करने की वजह से उसे शास्त्र जो है एक बोझ की तरह लगते हैं. तो प्रेजेंट एरा में हम शल्य और शलाक्य हम लर्न तो करते हैं, बट जस्ट टू पास द एग्जाम we learn so many classification of so many eye disease, ENT diseases, and so many surgical procedure in our Shushu Saita. But when it comes to OT level, OPT level, and IPD level, we don't apply all these things. So this was something I have experienced in my BMS. And what is your experience, Sangeeta?
Exactly. I can feel you what you want to say with this shlok. My experience was also the same thing. Actually, what we learn and what we see are totally opposite and different. For example, like we are studying the year-old shastra about shastra and surgical process of year-old in which is mentioned in Shushu Samhita. But in OT level, we are seeing that modern surgeries, but which is like pre and post op things, which is mentioned in our Shushu Samhita, like why and when to do surgery, and after post surgery, what we can do to like post operative things, what which is needed to be done, is not at all being applicable. Means we are not even applying those things, pre and post op things, which is mentioned in our Samhita. So the thing is, which is totally like our OPD, IPD, OT levels are like completely they are running on modern things. So why we are calling it Shalya and Shalakya Tantra? So so this is what I have experienced in Shalya Tantra, like use of antibiotics after in post operative things. So what you want to say like about that? Also,
Hmm.
you do you have any experience in Shalakya department?
Hmm. Not even in even Shalakya, we can see. Actually, when a principle is given, that is Sanshipta Kriya Yogo Nidan Parivartanam. That is, we have to find the Nidan, we have to find the cause before treatment. But now, when the patient came, we just start giving them treatment. For example, for the conjunctive, if the patient is coming with the disease called conjunctivitis, then we are giving him the allopathic treatment as well as some of the wash like Tifla wash. Even for sinusitis, we are just giving Nasya, Anutel Nasya or Shadbindu Tel Nasya. Even for the reflective errors, we are just like Tarpan is the only treatment which can even stabilize your number, or if you're not, that is there's not reversal of disease. These are actually just management. For otitis media, so many doctors, so many practitioners are doing Karnapuran. So this I have seen. So this is actually is going on in our OPD without finding the cause. They are just doing the treatment. Even in Shushu Samhita, it is mentioned that stage of disease matters a lot. For example, amam vipachyamanam cha sammak pakvascha yo bhishak janiyat sa bhavet vadyam shoshah taskar vitya. That means a bhishak has to know the condition of disease, the stage of disease, either it is a am, vipachyaman or pakva. If he is not aware of all this, then if he is doing this treatment, it is not just applicable for the shows. It is not just applicable for those shows. Actually, it is applicable for all the diseases. If the person is not aware of this, then we can't call them a doctor. We just call them a Taskar Vrit. So this
Yeah.
should be considered. The stage and state of a disease matters a lot. Even in otitis media, many of the practitioners do Karnapuran. After that, that infection increases. And the patient has put a question on Ayurveda ki Ayurveda is not working well. It is not about Ayurveda. It is about the practitioners. He has done the blunder. So this should be taken in light.
Exactly. When you told about the Tarpan and Kanpur and all those things, in Shalya Tantra also all the karms which are being very much, highlighted these days, like, Agni Karma, Jaloka, Siraved, the cupping method with karma, everything like you having a pain. So, for instance, pain relief, do Agni Karma. Any skin disorder or anything, you just do Jaloka and Siraved. For high BP, you do Siraved. So we are just becoming like what we are becoming. We are becoming technician or what, I don't understand that. Because like we are specializing things on karmas instead of what is the significance of that karma, what is the state and stage of the patient. We are not at all considering. We are studying in theory, but when it comes to OPD level, IPD level, we are not at all following the things. So this has become a marketing thing, I guess. Agni Karma. Every I have seen the students and practitioners are mentioning themselves that they are Agni Karma specialists. They are with Karma specialists, cupping therapy specialists. So this is the thing actually they are doing. They are becoming specialists in all those things. So this is just a marketing things which I have seen that they are making it marketing tool.
As you have said, it is a marketing tool. We can see that marm chikitsa. This marm concept is actually given in the proper form in social sari, but only for the prevention aspect, not for the treatment. During treatment, we have to prevent or protect that points. But nowadays, a chikitsa called marm chikitsa is a is introduced by some of the Vedyas, and they are calling it ki this is actually mentioned in our Sahitas. Sorry, even sugar management, BP management, and PCOD management by pressing some of the months are so much marketized. मतलब इसे बहुत ज़्यादा marketize किया जा रहा है कि these are actually the management mentioned in Ayurveda, but actually this is not. Marm is a concept is mentioned, but marm chikitsa is not mentioned anywhere in Ayurveda that I have studied.
Exactly, marm therapy has been popularized these days, has been very much popularized. Also, when it comes to the syllabus thing, Bhagna is being a very vast topic, which is in syllabus curriculum in Ayurveda also. But in OPD level, we are not seeing even a single case of Bhagna managed by managed by Ayurveda. So why we are studying Bhagna if it is like we are not managing? I'm just, for an example, I have just taken Bhagna. Everything which are in syllabus, we are not seeing in Ayurveda, means managed by Ayurveda. So, there is one shlok by Shushu that prataksho hi yad drishtam shasdrishtam cha yad bhave samasas udbhayam bhayo gyan vivardhanam. So, if we are not seeing what we are studying, then what is the use of studying those things? So, this is the things I guess we have covered a lot of things in our discussion about what is going on in present scenario. We'll take up all those questions which we have discussed to our guest speaker, Dr. Rajkumar sir and Dr. Ramya Krishnan ma'am. So I'll start with the first question. My first question is, general surgical processes are taught according to Ayurveda in theory. But in OT level, everything is done according to modern science. Also, the pre and post operative things like when and why is not according to Ayurveda. Antibiotics are used in post operative things. So, how can we call it Shalya and Shalakya Tantra of Ayurveda? Like all those things, all the operations we are seeing, either it's fistula, fissure, or tooth extraction, appendectomy, everything. Ma'am, you're not audible.
Oh, I'm sorry.
Yeah.
It was muted. Am I audible now?
Yes, ma'am. Yes, ma'am.
So this is one main problem we find in all other way. This is our 15th episode or 14th episode. We have been discussing about the erroneous application of all the angas of Ayurveda, like not only angas, whatever subjects are there distributed in the curriculum, the applied aspects, coming to the applied aspects, it is almost zero, or whatever is applied is many times wrong also. So the null effect is negative. It is not even zero, it is negative. It is creating distorted, distorted knowledge and distorted application regarding the science of Ayurveda. As you told very correctly, Acharya told also, Sharire Jaiva Shastrecha, Drishtarthasya Visharada, Drishta Sudabhyam Sandeham, Avapohi Ajaret Kriya. So you must be Sushruta Sharira, 5th chapter. Sharire Jaiva Shastrecha. If you are able to combine, you should see Sharira, you should see Shastra, and you should be able to rationally combine both. And then you have to remove your confusions in the mind, which is happening for decision making. So first of all, what we have to understand is that when a case is coming to Shalya OPD, whether the faculties are first of all estimating whether it is a Shalya condition itself or whether it is medically manageable. That is the first question. Whether if it is medically manageable, also Shalyadandra expert can medically manage. So Sudha didn't say don't take up any cases of non-Shalya intervention. Don't take up any cases. If you want to do medically, you refer to Charaka. He didn't say like that. He told all the cases, those cases which are you estimate, you appraise the subject properly, and whether it is medically manageable or surgical intention is there clearly. If it is medically manageable, it has to be managed medically by the Shalyadandra expert. But nowadays, what is happening when a patient comes and the moment he mentions the disease, even Rogi Pariksha, Roga Pariksha, Nidana Panjaga, Rogi Pariksha, history of the disease, history of the patient, history of present illness, history of past illness, what led him to this condition. For example, one diabetic retinopathy comes, only retinopathy is seen and diabetes is not seen by Shalyadandra expert means I don't know why diabetic retinopathy is incorporated in Shalyadandra even. It is a medically manageable condition. That is another thing. Whatever it is, if a Shalyadandra expert is supposed to manage diabetic retinopathy or macular edema, a Shalakyadandra expert, for example, diabetic retinopathy and macular edema or macular edema, a patient is coming to Shalakyadandra OPD. There is nothing to do, no Kriya Krama is intended in eye, right? Whatever is happening is because of metabolic error. So correction is required for diabetes and raised blood sugar and not for the eye. So there are many like that thyroid eye disease. In Shalakya, I am giving some examples. So these things, whether it is Swadandra Roga or Paradandra Roga or whether it is Nidana Arthagara Roga or Upadrava, that has to be discovered first. That is not happening. When a piles comes, only Sharasutra, or fistula comes, only Sharasutra or Agni Karma or whatever it is. Like there is no other option in the brain of a faculty. What to do, whether Shalya or Shastra or Rekta Moksha or what procedure is to do. And I am so much surprised to find that in Shalakya Tantra, the first topic that is incorporated in our curriculum is Kriya Kramas. Kriya Kramas are mentioned as the first topic in curriculum. It is like we are meant to become a technician, Panchakarma technician or technician to become. Like first of all, it is science-based medicine. Ayurveda is science-based medicine. Only if you are able to learn Shastra and Shastrarthas, every patient Shastrarthas are meant to be applied. It's not like Shalya Dandra, everything dealt with Shalya. Ultimately, everything is meant for the patient. So, Sadhya, Sadhyada is to be estimated, whether it is Shalya Sadhya or Bheshaja Sadhya, that has to be known. And treatment is to be initiated accordingly. But such a thing is not happening, and most of the diseases which are explained in Shalyadandra, I'll just mention a few, like I won't take much time. Thrombosis, atherosclerosis, all these are mentioned in your Shalyadandra curriculum. Goiter, lymphadenitis, varicose vein, tennis elbow, aneurysm, all these are to be managed by medically. There is no need of Shalyadandra here. I don't understand why they are incorporated. And what is intended compulsorily, one important aspect is Bhagna management. As Dr. Sangeeta told correctly, Bhagna, fracture management, very compulsorily to be learned. Application is to be learned. When we learn so much of theory, also no use. When patient comes with fracture, the Shalyadandra expert is supposed to do it. Instead of POP, we have to do whatever is intended and enable the patient to heal fast, faster than modern medicine. Many times it is happening when the proper procedure is followed in Ayurveda for Bhagna. But that is not taught anywhere. Unfortunately, only in very few colleges fracture management is taught and it is demonstrated and it is happening. And other things like fistula, cholecystitis, polylithiasis, esophageal varices. I don't understand what is the need of esophageal varices in Shalyadandra. In modern medicine, they cannot do anything. They need surgery. I have treated many cases of esophageal varices by avoiding surgery, by enabling the patient to get back to health. Even diabetes, hypothyroid and diabetes leading to esophageal varices, eventually such cases, they are reversed back to health. Health in the case, diabetes is reversed, hypothyroid is reversed. This is not telling merely to exaggerate things. This is what is happening. So once we are able to explore science properly, these things can happen. That is my thing. And Shalakya also, I will come to it later. Okay, that's all. So it is very unfortunate, altogether very unfortunate.
Good evening. Thing is, Kaya Chikitsa as well as Shalya, both are two limbs of treatment or management in Ayurveda. Kaya Chikitsa has its own importance in all diseases, in Prasudi or in Shalakya, in other conditions also. Shalya Tantra applications are there. So it should be considered equally that when a patient comes, whether it is the treatment is also two types of vyadhis are mentioned by Susruta itself, Vividha Vyadheya, Shastra Sathya, Snehadi Kriya Sathya. So it is not like all diseases, those who are coming to Shalya Tantra department are to be managed with Shalya itself. Tatra Shastra Satyeshu Snehadi Kriya na Pradishichyade. So those who are to be managed with Shalya, they are also they need to learn all these procedures, all these avastha and everything regarding the subject. In Vamana Upagalpaniya chapter, it is mentioned as dosha peshaja desha kala bela sharira ahara satya sattva prakriti vayasam avasthandarani. So yani anichin, it's just a procedure, but before that we have to assess everything. Dosha aushadha desha kala bela sharira ahara satya sattva prakriti vayasam avasthandarani. All the state and stages of the patient as well as the disease are to be assessed. So it is not like when an arthritis patient comes, you have to directly do Shara Sutra. Shara Sutra is a method discovered by someone or some expert in Shalya Tantra. So it is not like that. It is clearly mentioned in Susruta itself. Ajira Gala Jadani, Alpa Dosha Linga Upadravani, Peshaje. It has to be managed with treatment principles and medicines. Mrudu Prasarada Avakadani, Uchırdani, Sharena. So specifically, which condition is to be, Shara is to be applied. Karkasha Stira Prudu Katinani Aknina. So Akni Karma, where to do, when to do. And also Shastra Karma, in which condition? Tanu Mulani Uchradani, Playeda Bandi Shastrena. So it is very clear. It is not like all Arsho Rogis can be, Shara Sutra is to be applied. Even Arshas is not included in Roga Nidana syllabus. That is the most pathetic thing. Because they consider, means those who made the syllabus, consider that Arshas is to be taught only in Shalya Tantra. Arshas is not a disease that is to be managed by medicine, and it is only to be managed by Kshara Sutra or something like that. Pagandra is not in the syllabus. Vidrathi is not in the syllabus. Vrana Shobha is not in the syllabus. So that means only surgical procedures have to be done for all those conditions. So it's a pathetic condition. Granthi, Apachi, Arbuda, all these are not included in Roga Nidana syllabus. Roga Nidana should have all the Sarva Roga Nidana is mentioned in first chapter of Nidana. So it is not like Kaumara Bhrutya should learn this, Shalya Chikitsa should learn this, or Shalakya should learn only these chapters. So that itself causes so much distortion to the science. Once the patient comes, naturally a student getting passed out after this Shalya and Shalakya classes, they will be definitely thinking of this procedure only. Procedure is a very small part. Shastre Artha Vijnane, Pravrtu Karma Darshani. So, Shastra first needs to be learned. Artha or the Prayojanam. What are the objectives of the Shastra are to be learned. Artham is the Prayojanam. Pravrtu, what all treatment principles are to be done. Also, Karma Darshani, these procedures. So, karma has two meanings. Means karma is used in two meanings. Kartavyasya kriya karma. That which is to be done in proper time, in proper way is karma. And other procedures are also given the nomenclature karma, panchakarma. So 5 kinds of procedures or many shastra karma procedures. So all these procedures are to be learned. But before that, Roga Madho Pariksheda or Adhishana is to be examined, Samuthana Vishesha is to be examined, whether it is Swadandra Roga or Partandra Roga, everything is to be examined. Once you become an expert in one karma, like Agni Karma or Shara Karma, Estu Karmasu Nishnadu, Thashtya Shastra Varjidaha. So they will be thinking only from the perspective of that karma. Sa Satsu Pujam na apnodi. Vatamcha Richati Rajataha. So because of this procedural knowledge or expertise, they will be overconfident that they can manage everything. And that can engine so many complications. And Vatamcha Richati Rajataha. Estu Kevala Shastrajna Karmasu Aparinishtidaha. One who knows the Shastra, but Karmasu Aparinishtidaha, those who are not trained in these procedures, he is also getting confused. Some Mukhya Tyaduram Prapya. And he will be so much dependent and he will not be able to treat the patient. So both are equally important. First, we have to learn Shastra with Artha, Shastra Arthas, practical knowledge. Then Pravritti. And then learn the Karma. So without that, if you learn Karma alone, it's totally injustice to the patient and it is Shastra will be totally distorted. All these procedures given this much importance in syllabus as well as Dr. Ramya told, polylithiasis or all these conditions, Arshas, Pagandara, Vidrati, everything is included in Shalya. So that gives we have managed our son with appendicitis. He was having appendicitis. So by God's grace, we were able to manage within 2 or 3 days, the whole thing, increased TLC and everything came down. With that minimum medicine and correct diagnosis and the treatment principle applied. It's not our credit or by pride we are feeling all this. It is explained in the science. So we can apply and get results immediately. We can prevent surgeries. So this, what do you say? From a perspective of karma, if you learn, you will not be able to practice science. That is the thing I wanted to say.
Thank you, sir. Thank you, ma'am. Ma'am, as I've talked about Shalya Tantra, in Shalakya department also the situations are same. As Deepika was explaining about the Tarpana, unnecessary Tarpana in refractive indexes and in stye management or all the things challenging on conjunctivitis, they are seeing the irrational management. So what is your take on that?
Is it audible, no?
Yes, ma'am.
Acharya has told very correctly that Sarva Yoga Nidanokte Rahide Kubidamala अचक्षुषेर विशेषेण अष्टांग संग्रह उत्तरस्थान सर्वरोग निदानोक्तिर अहिदे कुबिदामला. Whatever diseases happening in eye is happening by sarvaroga nidana only. Sarvaroga nidana is causing dosha dushti, and dosha dushti is causing chakshusha vigaras, whatever kind it is, whether it is happening in Vartma roga or Sandhi roga or Shukla roga or Drishti Mandala roga, wherever it is happening by dosha dushti. Second is, so first of all, agandha dosha is to be deciphered. That is the first thing to be done in any eye disease. And we know that the present day diseases, so that should be the major aspect of curriculum. What kind of eye diseases? Updation is required. When we learn so many technical jargons from Samhita, so many terminologies are there regarding eye disease in Samhita. Every shloka is learned, and when we score maximum marks in theory exam also, when a patient comes with dry eye, or when a patient comes with a corneal ulcer or conjunctivitis, being a physician, how you are able to treat the patient, that only matters. If we know all the shlokas, it doesn't mean that you will be able to become a successful scientific practitioner. Only if you are a scientific practitioner, you deserve to be in practice. Otherwise, you have to stop it. As Ajarya told, she told correctly that taskare varteha. Otherwise, you are only robbers and not physicians. So it is very important. So I am telling that conjunctivitis, when we can divide in the same way as modern medicine is doing. There is nothing wrong in the modern world how people can understand diseases. We can use the same terminologies: conjunctiva, sclera, cornea, lens, uveal tract. Like this, we can classify diseases coming under each category. Like what are the diseases in conjunctiva, like conjunctivitis? What is the Ayurvedic samprapti of conjunctivitis? All the itis, whether it is uveitis or conjunctivitis or blepharitis, what is it? Itis means what? That we know that it is inflammation. So the underlying principle of inflammation is to be applied there in diagnosis and treatment. So what is the underlying principle of inflammation in Ayurveda? Only SPBA has deciphered it and published it. Others, when you ask, some will tell that it is pitta, some will tell that it is rekta, some will tell that even infection is considered as bhuda, agandha yoga. Like that, multiple opinions are emerging. So in every Ayurveda college, conjunctivitis might be considered in a different way, and not inflammation is managed. Many cases I know directly that Yashti Madhu Seka, etc. is advised, Tribala Kashaya Seka, etc. is advised. Seka is given in much importance. We know that inflammation is deciphered in SBBA. Being both of you SBBA learners, you know that it is contraindicated for any Seka karmas, upakramas. We have to reverse the inflammation, conjunctivitis. You know that being in Hastalamba, you are taking up cases of viral conjunctivitis and bacterial conjunctivitis. You know how fast it is subsiding, right? So what is the treatment principle there, and what is happening in Ayurveda colleges are different. In the same way, a patient comes with glaucoma or raised intraocular pressure. What is the treatment principle? How do you understand the specific patient with glaucoma? Glaucoma can happen by multiple reasons. It can happen by autoimmune cause. Sometimes it can be mere inflammation. I have seen many patients of glaucoma after COVID vaccine. So many new patients with raised IOP. That might be associated with some other conditions also. So like that, so what is the treatment principle is to be decided by the nature of samprapti. Whether it has happened by ama or ama visha, or whether it is something else, avarana. Whatever it is, we have to decipher the nidana samprapti. So again, all these things are dependent on yoga nidana and dravya guna vijnana. We must be able to explore vyadi bheshaja prabhava tattva. VBPT, Vyadi Bheshaja Prabhava Tattva, is to be explored in Shalakya, Prasudi, Kaumara, Shalya. Everywhere this is applicable. We are not technicians, we are physicians. We should be able to understand and treat. One who is understanding and treating is called as doctor. One who is not understanding and treating something is called as quackery. It is not medicine, it is quackery. So it is very important. Retina, retinopathy, retinal detachment, retinitis. We can learn modern, we must understand Vikara Prakriti. तस्मात् विकार प्रकृति अधिष्ठानान्तराणि च समुत्थान विशेषांश बुद्ध्वा कर्म आचरेत्. So that is what is called updation. Updation means what kind of diseases are happening. For example, papilledema comes. We know that papilledema can happen by raised BP, raised hypertensive patients can get, tumor can cause papilledema, sometimes infection, bleeding, all these can cause papilledema. So once we know that, we have to decipher in Ayurveda what diagnostic principle and treatment principle is applicable here in hypertensive patient with papilledema, in tumor cases, bleeding cases, whether it is surgical or medical. Again, optic neuritis, same. It can happen by what you call multiple sclerosis, autoimmune conditions, herpes, sometimes viral infections, etc. So the infection or the cause has to be deciphered there. And we should see a large number of patients in the OPD. Nowadays, what I understand is that most of the cases who are admitted by Shalakya experts are diabetic retinopathy or what you call refractory errors, myopia and presbyopia. Mostly, I don't know whether such cases of papilledema or complicated macular edema or even diabetic retinopathy, I don't know whether they are admitted. Are the cases admitted? What all cases are admitted now in Shalakya? Mostly in both, according to both of you. Can I know? Admission, I am asking.
Ma'am, myopia I have seen. For otitis media I have seen. Refractive index mostly.
Yeah, otitis media also, there is no need to admit otitis media. There is no need to do nasal polyp surgery. Actually, we know nasal polyp is happening mostly by what? By Dushivisha. It is deciphered in SBBA. So these things we can manage in OPD itself, most of the cases. Diabetic retinopathy, diabetes is to be managed. And at the same time, some other basic principles of Shalakya management, Shalakya diagnosis and management, they are not dry eye. What are the causes of dry eye? Nowadays, very common. Dry eye is very common. So what are the present day causes of dry eye? Metabolic eye diseases. All these things are to be taught properly. Even we can reduce the Samhita oriented portions in Shalakya Tantra, or we can induce translational knowledge of Samhita oriented portions into practice. Samhitas are meant to practice, not to by heart and get good marks. If we know all the shlokas also, in the patient in front of you, what principle is applied here? How and why? What is the treatment principle to be applied here? How and why? These things are to be taught in the OPD and IPD. That is called translational medicine. And sometimes many of the eye manifestations will be of systemic diseases. May not be primarily eye disease. So these conditions are to be well explored and explained. That's all.
Same what I have mentioned in the previous question. Actually, it's Utvanga Rogas. Utvanga Rogas have specific importance, but everything is what you are learning in Kaya Chikitsa. Kaya Chikitsa or Sarva Roga Nidana, Dosha Dushti, Dosha Chaya Pragova Prasara is happening. And by Achakshushya Nidanas, it is manifesting in Chakshus. By some other Nidanas, it will be manifesting in Nasa or it will be manifesting in Siras. But the same Nidanas are applicable there. So all the Nija Rogas are starting from Dosha Dushti. So all these procedures are externally, we are trying to do something to regulate something. But actually, the Nija Rogas are to be managed from with medicines or treatment principles itself. It is not like Netrabhishyanda. It is mentioned as Sangramika Roga, Sangramanti Naratnara. But it will not be transmitting from one person to another. It's a Nija Roga only. Jwara is a Nija Roga only. Or Shosha is a Nija Roga. Sangramdi, Kushtam Jwarascha Shoshascha, Sangramdi Narat Naram, Netra Abhishinda Evacha. So it is mentioned as Kushta will be spreading from one person to another. It is not like always spreading. It's a Nija Roga. Dosha Dushti is happening. After Dosha Dushti, it's reaching Thadus or Thadu, Mala, Sroto Dushti is happening. So it has to be managed in the same manner itself. Like Dosha Viparita treatment is to be applied. What is the stage of the disease? What is the stage of dosha? Everything we have to understand. It's Netra Abhishyanda is not an Agantu disease or by bacteria is not directly causing. So there are certain things which are happening inside the body. Kalartha karmanam, dhinam ityadi matraga. Samyak yogasya viknayo roga arogya eka karanam. It's not external agent that's producing. It is body's response. So we have to correct the body's response. In Netra Abhishyanda, we need not apply anything externally also. No need of any tarpana or kudapaga or aschodana, anjana, nothing. We can manage with the treatment principle of this inflammation or infective conditions, which we have deciphered in SBEBA or science-based evidence-based ayurveda. So when these procedures are given importance, you will be always thinking from the perspective of procedures only. That is the main problem. These procedures are to be known. That doesn't mean that you have to apply in all cases. Just like Panchakarma is given separate importance. All these procedures can be learned along with Panchakarma itself, or those karmas, those procedures which are to be done. All these things can be learned together. But its application is most important. When you are learning this practical in Yoga Nidana, that how to do hemoglobin concentration, how to understand total leukocyte count, we are not going to become technicians. We need to know what all are its clinical aspects, how to understand the patient with these lab reports. For what we are doing all these things. In the same way, in what aspect, in whether it should be done or not, that is to be known first. So, Shalya, practical exam should be like that. If the patient doesn't need Shalya, means surgical procedures, the student should identify it as Aushadha Satya itself. Otherwise, if all the conditions that are obtained in Shalya, if the student is made to diagnose it as this Shalya procedure is to be done, Padana is to be done, Chedana is to be done, or Vedana Karma is to be done. So, student will be automatically thinking in that way. That is, it is taming like that. The syllabus which is copied from Western syllabus, MBBS syllabus, is totally, I would say that it is blunder, because we are not considering anything regarding Ayurvedic perspective, and completely copy syllabus is self-destructive. Our science, what we are learning, will destroy us itself, because it is distorted and it is not ethical.
I think I would like to add there, I think some kind of obsession has happened to Kriya Kramas. And I don't think Kriya Kramas are applied in the right mode. And I don't think most of the students are not getting sufficient training in Ashodhana or all these procedures, Udabaga, Tarpana, Anjana, etc. They are not getting procedures trained also. If they are to be trained, that can be trained in healthy volunteers also. These upakramas can be shown in healthy volunteers also. It doesn't need to be done in patients, all the patients to be admitted for these upakramas. To show upakramas, patients are exploited means it is very bad. If you don't know, to show the student Panchakarma is to be done by Panchakarma department is no way reasonable. If it is manageable by one medicine scientific diet approach, why to make the patient admit for so many days, initially fixed days, package days, 7 days, 14 days. In Ayurveda colleges, this is happening, no. In every department, when the patient comes, initially itself, this much days treatment is required is determined. How that is determined like that without any sort of professional appraisal? This is a matter of disgrace and shame to us. There is no wonder that, as you told, cupping therapy and other many such blunders. I won't say that they are blunders outside Ayurveda, but in Ayurveda, if they are incorporated, it will become a blunder, as if our acharyas have done nothing for us. Our acharyas have done zero contributions to us. Like that, these people, those who are advising cupping therapy and other things, they are doing grave injustice to this science. And there is no wonder that modern medicine doctors are blaming us, modern medicine doctors are ridiculing us. We deserve to be ridiculed. Why? Because our attitude is very unprofessional, our curriculum is unprofessional, our training methods are unprofessional. We are not able to rationalize a patient, we are not able to explain a clinical condition to the outside world in terms of Ayurveda. We are not able to predict, we are not able to reproduce the logics what we are applying in a patient. So we are negative. I won't say that we are zero, we are negative. Right now we are negative, under mud, under soil. It's a matter of deep disgrace to our acharyas. And unless and until we open our eyes inward, there will not be any change. It's going to be complete darkness. We are in darkness. That's all.
Ma'am, I have a question. Instead of having pure Ayurvedic hospital like in Aya, like in Tibia College, why in our OPDs the food we are giving in the IPD patient are according to the allopathic system, like dahi, butter, and all this anda. And when we complain to the PG scholars or teachers, they are saying from where they will get the calcium or protein. So this is something to be addressed.
Yeah, exactly. Very correct. I was surprised to know from a PG scholar who wrote to me that in her college, it is like after Panchakarma and after any Kriya Kramas in any department, they are given all these things. Now you are also telling the same. So it is a matter of great alarming thing, distress. It's a matter of great distress because we are causing tremendous harm to the patient after undergoing these Kriya Kramas. Then what is the need of naming it as Ayurveda? The college name itself has to be changed. If like that it is happening in any colleges, they can do whatever they wish considering nutritional deficiency. They can give protein powder or egg white or mutton or chicken, whatever they wish. But don't call it Ayurveda, that's all. Change the label of Ayurveda college. Ayurveda is a highly scientific science which explains every crucial aspect, subtlemost way that regarding the nutrition. What kind of nutrition is, as you know, what is Sandarpana diet and Abadarpana diet. What kind of diet is to be given in different Kriya Kramas in different patients, different state and stage, different cause mechanisms. We know that there is no such a science which has explored food items. All the food items, whether it be shali or mudga, whatever it is, shimbi varga, dhanya varga, taila varga, all these things, paniya varga, even drinking water, how it has to be scientifically administered to the patient is explained in only one science, and that is Ayurveda. It will take perhaps 1 century minimum for modern medicine because their present way exploration is in wrong direction. So it will take at least 100 years for modern medicine to understand our scientific principles of nutrition. So after infection or after inflammation or after Kriya Krama, Peyadi Krama or Tarpanadi Krama is advocated, if a patient is given other things considering wrong nutrients, wrong nutrition, if it is administered, we know that his condition, his or her condition can escalate to fatality. It can cause sooner or later, it can cause emergencies or complicated conditions, more complicated conditions for which other treatments will be required. So it is very unfortunate that it is happening. There is no clinical audit. There is nothing in Ayurveda to evaluate quality control in prescribing. Every hospital is NABH accredited for having all these facilities in the hospital. Facilities in the hospital cannot make a patient heal. For that, intelligence of the physician, quality of the prescribing, quality of prescribing is very much crucial. Quality of treatment that he gets. Hygiene is not sufficient. Hygiene is not enough. We know that brain quality matters, and there is no uniform rational standards adopted in Ayurveda for diagnosis, standardized diagnosis and treatment, as I tell in every live. So these things are to be rectified for that. Then only a change will happen.
The change, what we need is, it should be, am I audible?
Yes, sir.
Change which we need to produce is, the patient is to be diagnosed, and Aushadha, what the treatment principle is applicable there, that has to be done. And according to the treatment principle, the patient has to be managed. Once dosha dushti, everything is subsided, and if the disease is persisting, can be referred to one surgical procedure. That surgical procedure should be done in Ayurveda colleges or Ayurveda hospitals itself. And after that, everything according to post-operative measures should be done according to Ayurvedic procedures itself. Then only that can be called as an Ayurvedic procedure. Otherwise, everything is blunder. No. Till then, or without doing anything, we will be sending the patient to allopathic system, and they will be doing some surgical procedure, and patient will be coming back to us for another disease. So we are not attending the basic cause, basic mechanism is not reversed. So always the disease should be managed with hetu viparita. So evam anyanapicha vyadin, so nidana viparya. After that, if the disease is persisting and if any surgical procedure is needed, or if the disease has a course like vrana is developing, so vrana shodhana ropana has to be done. Otherwise, the basic nidana is to be removed, and then the surgical procedures, 1 or 2 or 3, padana, dharana, lekana, eshana, whatever be the thing, it has to be done in Ayurveda colleges itself, and the post-surgical measures are to be done by done with Ayurvedic patya, Ayurvedic this guna vikalpa or dosha rasa vikalpa with should be Vaidya. So Vaidya should be able to assess what deficiency can happen and how to compensate that. That is what is rasa vikalpa. Rasa vikalpa. Susruta also told in the last chapter, he has told that Pisha Karta, Atha Karanam Rasaha, Doshastu Karanam, Karyam Arogyam. So all these 4 components are required for proper treatment. In Ayurveda colleges, the proper method is post-surgical. Till surgery as well as post-surgical things are to be managed by Ayurvedic measures itself, and the present way is completely affecting the science, and it is totally unscientific method that's going on.
Thank you,
I
sir.
think Dr. Zania.
Next question, Deepika. Your mic is mute.
Not audible.
Ma'am actually has covered this question, that is the Kriya Karma, which has taken new heights these days, like Agni Karma, Vidya Karma, Sirave, Jaloka, Prachan, Tarpan, Karnapuran, etc. We are seeing some short-term benefit also, but what is the significance with Ayurvedic principle in terms of recovery of pathology, reversing of pathology?
Actually, that is what
Half an answer,
Dr.
ma'am.
Rajkumar sir told. No? Every Kriya Krama has its own specific indication and contraindication. So, Chedya Roga, wherever Chedana is required, only Chedana compulsory. Chedana is compulsory only, it is required. Jalauka, wherever it is compulsory only, it is required. Rakta Drushti doesn't mean Jalauka. Nowadays, for acne vulgaris also, Jalauka Jarna is happening means, my God, what a level of what a level of pathetic practices irrational practice on peak is happening in Ayurveda colleges. Why to do Jalauka Ujarana in Mugadushika? I don't understand. Actually, strictly intended conditions, these upakramas are required. These upakramas are, such kind of studies are required. Nowadays, relevance of these so-called upakramas in present day scenario. Most of the diseases are acute, and most of the diseases are caused by Ashuddha Chikitsa. And most of the diseases are Vyadhi Sangara also. Moreover, when we come to the patient aspect, Rogi Bala is very less, or Rogi Ojas is most of the times abnormal. There will be Ojo Visramsa or Ojo Vyabhat or Ojo Kshaya in most of the patients. And Ojo Vyabhat is most common because Viruddha Ahara, Agni Dushti, Tridosha Dushti Nidana, all these are commonly seen today. And Viruddha Upakramatya Rogas are very common today, because most of the times modern medicine and Ayurveda will be combined and administered in patients. Most of the times patient will be taking anti-diabetic drugs. Along with that, for arthritis, they might be taking 2 kashayas. What will be the result of that? In their both are going to the same body, and the patient is coming to Shalakya expert for something else. So for glaucoma, for example, she is undergoing treatment in Kaya Chikitsa. 5 kashayas or 3 kashayas and 2 tailas are prescribed, and she is taking anti-diabetic medications, and she is coming to Shalakya OPD for eye condition, glaucoma or dry eye, whatever it is. How it is approached? If it is approached by some upakrama, external upakrama means, what does that mean actually? It is the most important thing in Ayurveda is that Ayurveda is a functional medicine. Ayurveda is functional medicine. Ayurveda advocates to treat patient and not disease or symptoms. So patient rogamado pariksheda tado anandaram vekshidam tada karma vishak paschat. So it is a sequence. We have to do step by step. We have to understand all the samprapti ghadagas in the patient presenting. So Kaya Chikitsa expert has to sometimes, when Kaya Chikitsa expert is treating for one disease, eye disease will also subside. There will be no need to refer to eye disease or Prasudi department or Shalakya department. Vice versa also, when Shalakya patient is being handled by Shalakya expert, if he is a bishop or scientific practitioner, there will be no need of separate medicine for arthritis. Whatever is done in Shalakya, we are seeing that in SBB, functional medicine. We are the super specialists of Ayurveda. SBBA practitioners, every Ayurveda practitioner deserves to be SBBA practitioner. Science-based, evidence-based Ayurveda practitioner. They are the super specialists of human beings. See, you can do speciality in different things, but unless you acquire speciality in human being, there is no use of other specialities, right? We can reverse an eye disease by Langhana or Vyayama. We can reverse Viruddha treatment principle. We can reverse an autoimmune arthritis. So, what is the need of different, if it happens in child or if it happens in woman or if it happens in man also? Dosha, samprapti, everything is same only. It is standardized. Only thing, according to the patient, we have to modify that is what is done in ETA, evidence triad approach of SBAB. So, only thing, upakramas are to be taught in specific indications. And for attaining upakrama jnana, practical training can be given, no problem. But it can be done in healthy volunteers also, or in patients in strictly intended situations. But you should not be obsessed by upakramas. Cupping therapy and all has to be removed from the curriculum if it is there. Or if anybody is doing, my sincere request, don't do such what you call stupid things in front of students. You are defaming science, you are defaming your own identity if you are doing it, and you are distorting the science also. Please rethink and remove such things. If your version is that patient is getting benefited, please understand Ayurveda is not meant to produce benefit and risk. Acharya didn't say benefitaya kalpade. Tadaiva yuktam vaishadyam benefitaya kalpade. He didn't say tadaiva yuktam vaishadyam yad arogyaya kalpade. So reversal of disease and emerging health is the objective of Ayurveda. So please don't do such unscientific practices.
Those who are learning or those who are acquainted with SBEVA might have known that only 1% or less than 1% of cases require all these procedures. So it's very rare that they require such procedures. In allopathic hospitals also they are doing unnecessary surgeries. And when it comes to Ayurveda, you cannot take a procedure out from the science. Like if you take an active principle out of a dravya, it will not become that dravya. And it will be having so many problems also, or it can cause so many risks to the patient also. In the same way, if you take a karma out and if you apply that karma in all patients, irrespective of their state and stage or status, that will be causing risks only. That will not produce any sort of benefit in that patient. Forget about arogya. It will not produce any sort of benefit and it will be highly risky to the patient also. So this karma, based on karma, when you are doing treatment, it's not scientific, it is completely unscientific, and as it is taught to students also in that manner, now the present situation is completely unscientific practice is going on. When an SBA practitioner is practicing, he is integrating all the conditions of the patient by himself, not by referring to other systems or other this thing. So what Dr. Lemia said was exactly true, that we are super specialists because we are able to integrate everything. What present day, what we are seeing, it's highly, we are getting saddened. And it's a desperate situation that we are not able to do anything, and this is getting, this, everybody is behind business. What allopathic system is doing, exactly following that and doing business only. And we are not practicing science, and patients are not getting the exact benefits of Ayurvedic science.
I would like to add a point there regarding the surgical procedures. Those who are opting for surgery will be definitely inclined to do surgical procedures. So what I understand from the Gazette is that some 58 procedures or some procedures are approved for Ayurveda surgeons also to do. So those surgical procedures are to be trained in Ayurveda medical colleges, and those surgical procedures, a fully fledged theatre should be there in Ayurveda colleges. Every Ayurveda college, fully fledged theatre should be there to perform these surgeries. Whatever surgeries are approved for Ayurveda doctors, those Ayurveda surgeons, they are to be conducted there. And once they are conducted efficiently, definitely more and more surgical procedure approval we will get eventually. But for doing that, modern surgeons, right now, modern surgeons have to be posted in Ayurveda medical colleges. Those surgeons who are willing to teach these procedures. Why should we go to a modern hospital? It is very, very disgraceful to go to modern hospital to learn surgery, and they are doing so much of discrimination, and this is happening for years, that we will be considered as second to them and they will be humiliating us. We all have got miserable experiences in modern hospitals. Why should we go behind them? We are also learning a medical system which is having equal identity and dignity as of modern medicine. So why should we go to a medical college and get ourselves posted there? I think you are posted in ENT and all these IOPD, all these places. I don't know why you are posted there. So to teach surgical procedures, surgeon has to come to Ayurveda colleges. He has to perform surgery in the way of, like Ayurveda, Shalyatantra experts will decide whether surgery is needed or not. And if surgery is needed, It is to be done by the surgeon, and he has to give training to Shalyadandra experts as well as PG scholars and students in Ayurveda college itself. And actually anesthesia, there will be a need of anesthesiologist. Definitely Ayurveda surgeons or Ayurveda doctors should not be doing anesthesia, as we know the risk of anesthesia. Anesthesia is to be done by an anesthesia expert doctor itself. He has to be posted in Ayurveda colleges, uh, and those in the presence of that anesthesia expert, Shalyadandra experts should be learning and practicing surgery under the guidance of a surgeon of modern medicine. Initially that will be required. This is to be done. Then students can learn, both UG and PG scholars, they can involve themselves in surgical procedures in their own colleges. They don't need to go somewhere and learn. And next, post-operative care. Post-operative care, sterilization methods, all these are to be done by Ayurvedic scientific methods. It is shameful to adopt Western drugs in post-surgical care, sterilization, etc. As if Ayurveda has explained nothing regarding sterilization, nothing regarding post-surgical care. It is what a disgrace to Acharya Sushruta. It is a biggest disgrace to this science, and Acharya Sushruta, who is the father of surgery. He has explained this much, how to disinfect, how to make the wound heal as early as possible, surgical wounds. What is to be done how to maintain sterilized conditions in uh, patient diet, patient regimen, everything is explained so, what you call, how much elaborated manner. And Ayurveda, Shalyadandra experts are giving antibiotics and painkillers means very biggest disgrace that can be avoided if you are ready to learn. In SBBA, we are taking post-operative conditions. We are managing with Ayurveda medications, minimum medications, by adopting SBBA principles. So where there is a will, there is a way. It is possible to adopt post-operative care by scientific Ayurveda strategies, which can be done in Ayurveda colleges. There is no need, and surgeon who is visiting colleges must be ready to explain things. These things cannot be learned in theory. These things are to be seen. You are to involve in the procedures. Only if a student gets himself involved, he will be learning. This is a skill only. So there should be every opportunity in Ayurveda colleges. Fully fledged OT should be there, and all the Ayurvedic sterilization equipments and medications should be available, and patients should be taken care of by Ayurvedic scientific methods in perioperative and post-operative.
Thank you, ma'am. Thank you, sir. I guess in two questions, elaborated all the things. So our next questions will be, if you will answer in one word or one line also, it will be okay because of time limits. My next question was about Bhagna, which ma'am has covered in first question itself, that Bhagna being the vast topic in syllabus, but yet we do not see any cases and we do not treat Bhagna cases. So anything extra you would like to add?
No, it has to be trained, that's all. It has to be trained, taught and trained properly.
Yeah. Question.
Then why all the low back ache cases, irrespective of the Nidan Samprapti, are seen uniformly diagnosed at Katigra or Gradrashi and are treated by Katibasi treatment or traction?
Yeah, it's. I'm remembering my internship days. No, my final year exam days. All the beds will be KG or G. Kadigraha or Grudrasi. One bed Kadigraha, next bed Grudrasi, and traction will be there. Most of the times I will be assisting to do that. Traction also. So my only memory in Shalyadandra is this only. LBA, low backache. Either Dhridrasi or Kadigraha. So this is the condition. Why backache? What is to be done? Hetu Samprapti. Whether traction, what is the need of traction in Ayurveda? Kadi Vasti. There is no Kadi Vasti explained in Ayurveda, mentioned in Ayurveda. I don't know from where Kadi Vasti has emerged, putting oil in on the back as tada. I don't know what is the rationale in that. Actually, whether it is the cause mechanisms are to be explored and low backache has to be reversed. Traction will only increase the space and reduce the pain. Increase the space between the bones and reduce the pain by decreasing the compression of sciatic nerve. That's all. Just a physical technique. Is that the way to manage low backache in Ayurveda? It's not the way, no. It has to be destroyed. Most of the time, it can be reversed by Bheshaja itself. There is no need of admitting patient also. So, it's very bad, like pinpointed diagnosis and treatment principles are not there. And patients are simply admitted and some drama is happening. I will not call it Upakrama also. It is drama, not Upakrama. What is going on? Unfortunate for people and patients.
Again, the same problem. Patients are looked from the perspective of karmas only. Whenever the patient comes, first thing that comes to the physician's mind will be, he is perfect for this treatment, or this upakrama, or he can be kept in basti for 10 days. So it's prefixed without assessing anything and without checking for this dosha, dusha, or sotas, whatever it is, whether he is fit for this medicine, whether he is fit for this karma, that is the only thinking that comes to the mind of physician. It is like that. It has become like that. It has to completely change. Roga Madhu Parikshada means it has to be examined in the proper way and then determine the treatment principle. And with that treatment principle, after the removal of Vidana, whether any procedure is required or not is to be determined afterwards. In less than 1% cases only, these procedures are required. Otherwise, it's just you are making the patient spend so much money and making this treatment costly, and finally he will not be getting the intended effect also. Totally, uh, science will be disregarded, and people will also think that Ayurvedic science is like this, and it's not going to give you benefit in a short period, or it will be taking long time, and you will be undergoing such procedures or such things for a long period. All these are because of distorted knowledge or ignorance, or distorted curriculum and teaching method. All these are made by the physicians itself or faculties itself, not by the science.
Indeed, sir. Relevance of marm therapy in Shalya Tantra.
Marma is explained as anatomical points, no? Anatomical points and surgical importance when the trauma happens to marma. Also marmobhaghada. All these are mentioned to understand the importance of marmas in Shalyatantra. When you are adopting a surgery, how to take care of marmas. For that, emphasis is given to marma, understanding of marma or knowledge of marma, scientific understanding of marma. But marma chikitsa, I don't know how it happened to be incorporated in Ayurveda. There is no marma chikitsa in Ayurveda. That is done by some traditional healers of Kerala, not qualified practitioners. Tradition-based healers. They are doing some marma chikitsa with some medications. Definitely, they might be using some Ayurveda medications, but that is not Ayurveda because science-based medicine principles are not adopted.
Yeah. Just like marma therapy, cupping therapy also. So today morning when I inquired, it was found that somebody was telling that needle is having a hole in the upper end, so it is not acupuncture. So I asked whether it is acupuncture or not. So one student told that it is having a hole in the upper end, so it is not acupuncture, but it is Ayurveda. How it becomes Ayurvedic science? As it's having a hole in the upper end, it is not acupuncture, but it is purely Ayurvedic. And many are practicing this cupping therapy and Marma Chikitsa, and everybody is praising them like he is expert in Marma therapy. So how come, I was wondering, how come this becomes scientific and how people are being praised like this? So anything is acceptable in Ayurveda. That is the thinking of all the faculty, including faculties. Faculties will be inculcating that thinking in students also. Whatever be that, you have to accept. And those who are receptive only can improve in their profession. So such bad impression created in students will be passed on to next generation also. That's wrong. It's completely wrong. When cupping therapy is wrong, somebody should tell that this is wrong. Or when that Virka Chikitsa, that was what I was mentioning about acupuncture. Virka Chikitsa, it is not mentioned in Ayurveda Chikitsa. Ayurveda advocates Rakta Moksha. In Rakta Dushtija conditions, Rakta Dushti doesn't mean that Rakta Moksha is indicated. There are so many specifications with which we need to reach the conclusion that the patient is fit for Rakta Moksha. Or Udara draining of fluid or Mudra Vritti. So in such conditions, Vedana Shastra Karma is required. Otherwise, this Veda with a hole on the upper part is for Vedana Shamana and it is for Vata Shamana. So such explanations are totally unscientific and they are trying to substantiate that whatever they are doing is correct according to Ayurvedic science. It is blunder.
Yeah, and they say that this is the beauty of Ayurveda.
No, actually, quackery is encouraged. Quackery is
Yeah.
encouraged in Ayurveda by doing this. How much serious offense it is? How much serious? Your lives are precious. You have joined Ayurveda college. You and I have joined Ayurveda college with hopes to become a scientific practitioner. And if you are learning cupping therapy and doing in all patients, you just imagine that level of serious misfortune that is happening to Ayurveda students. Students of Ayurveda, I sincerely pray that this condition changes by our talk. Let our talk be a motivation for at least a small community of sincere and honest people who are having dedication and passion towards our own system and profession. Let it be a change, cause of change. I really appreciate both of you for conducting this and the entire team of Yadhartha Bodha for coming up this much boldly, confidently and telling the truth openly what is happening. Unless you tell, we will not be able to know. Even though I am a faculty, I'll be more caring about the wrong things in my department only. But when you are telling and when we are meeting, we are coming to know more and more things. Unless we meet and discuss, there will not be a change. So we are initiating it. Thank God for that.
Exactly, ma'am. Thank you, sir. Actually, they all the therapies, someone has told that for Vidkarm, some Vaidyas charge 10,000 rupees. So, physicians are charging that much things on therapies, and it has become a business to earn money. And it's like by just doing injustice to patient, we are earning money, which is itself a dharma. So hopefully some change will happen with this talk and also the syllabus points which are being mimicked, MBBS. I hope it should stop with our talk and our rights which has been denied in BMS college has to be changed with our talk and collectively we can do something without collectiveness, we can't do anything, and we can't reach to higher authorities also. So we are just praying that we reach to a large number of audience so that we can see that yes, the injustices are having because even students are not knowing that injustice happening with them. So this is the worst condition actually. So they should know that injustices are happening. This all therapies, they are not meant to do this all therapies and become technician. They are meant to become physician and treat patient. Uh, if they want to earn money, do some other business. This is not the Ayurveda, and any medical profession is not the way to earn money, I think. So,
Actually, the problem is we have to see the patient in our own place. When we become sick and we go to a physician, somebody is doing cupping therapy and taking money from us. Again, we are getting the same complaints very soon. What will be our, not only cupping therapy, I just gave one example, wrong treatments, unscientific treatments. Being a physician is a mission and not a profession. It is more a mission than profession. Mission of healing, not mission of benefit risk. Benefit risk is for allopathy, do no harm. They cannot do anything without harm because they are intending to produce benefit risk ratio. For us, it is not that. We can do the intended and heal. For that, scientific steps are required to be learned and taught properly. Then only change will happen.
And Ayurveda Charaka also very specifically says, Arthartham, Napi Kamartham. Matlab, Bhuta Dayam Prati. Our objective is Bhuta Daya, universal well-being. Vartade is Chikilsayam Sasarvam Ati Vartade. So it is not for money, the Arthartham, the Kamartham. Not according to our wish. It is to be solely intended for Bhuta Daya. Bhuta Dayam Prati. Vartade is Chikilsayam Sasarvam Ati Vartade. So if everybody is having that intention in their minds, this unscientific practices and unscientific thinking will not emerge. Thank you.
so true, sir. And we both thank you so much that to providing this much wisdom so that we are able to see the injustice happening to us and everybody. अगर आप लोग नहीं रहते तो I guess we can't even see that we are going through such injustice. So because of you two only, like many people, I guess all over India, students, physicians, everybody realizing that yes, scientificity was missing and we were having like we were doing wrong things only. So and students got to know that yes, injustice was happening with them. So it's all because of you only.
We owe
We
to God for
sincerely.
that. It is only because of God only. We were not, we have also studied in BMS in the way you have studied. So it is all because of great God only we owe to Him. Hare Krishna.
Thank you. Thank you so much, ma'am. Thank you so
Namaskar.
much, sir.
Thank you.
Namaste.